4 years, thousands of dollars, leading to one degree, your nursing degree. Today, I'm going to talk about how you can become a nurse. It takes about 4 years if you want to get your bachelor's of nursing, and it can be a long process and overwhelming if you don't know exactly what steps you have to take. Comments down below what step you are in this process, and hopefully this video helps you so you can truly understand how you can become a nurse. Let's get started. Step number one is your pre-nursing requisite, or we call it the prereq. This is done before you apply to nursing school. The prerequisites is foundational course before you apply to nursing school. These subjects include anatomy and physiology, microbiology, statistics, English, and even fine arts. You may wonder, do I really need to take these prerequisites? Are they important? Yes, they really are. For example, anatomy and physiology teaches you how your body works. Microbiology teaches how your body fights infections. And chemistry, although it can be a very challenging subject, it teaches how the medication interacts with your body. I recommend that you take your prerequisites seriously because that actually bumps up your GPA. Most nursing programs want your GPA to be higher than a 3.0. That gives you a greater chance of you getting accepted to the nursing program. It takes about 2 years for you to complete your prerequisite, so take it seriously, learn a lot. Now we're going to step two, applying for the nursing program. Step number two is applying to nursing school. Yes, you finish your prereqs, that's amazing. Now the big thing, I need to apply to nursing school. How am I going to do that? It depends on each nursing program. Majority of nursing programs want you to take a TEAS exam. The TEAS exam combines science, math, English, and it's pretty much just a baseline. Do you know the basics? Then you may need to do a personal essay. Most personal essays will ask you, why do you want to become a nurse? Do not state a generic answer. They want to know who you are. Is it because of the personal life situation? Is it because you want to cater to a particular patient population? Or maybe you were sick and a particular nurse in your life made a difference and that motivated you to be a nurse. Find something personal. Do not state a generic reason. Number three is letter of recommendation. Yes, I know it can be really troublesome asking someone to write something about you, but it's very important. Find 2 or 3 people that you look up to and that will state the good characters that you have or your work ethics. Ask them early so you can give this to your school that you're applying to on time. Now, the next one is having a good GPA. Your prereqs are very important because that really determines how your GPA is in college. So the better your GPA, the better chance of you getting accepted to a nursing program. And finally, submitting your official transcript on time. Get that official transcript early. It takes a while. A quick tip regarding the TEAS exam. Prepare about 4 weeks in advance. It's not too hard, but don't take this exam lightly. This will actually determine and help you get into the nursing program. Now you got into your nursing school. You got the accepted letter stating you have been accepted to nursing school. Yes, it can be very scary. You can be stressed. You may start sweating. You may wondering, can I actually become a nurse? Can I really survive nursing school? You may have heard that nursing school is hard, it's challenging. It is hard, it is difficult, but it's also very doable. I did it, you can too. There are a few courses that you will definitely have to take in nursing school. That includes pharmacology, which teaches you about medication, medical surgical, which talks about different health conditions, particular to adults. Pediatric is about health conditions for infants, adolescents, and newborns. Psych, which talks about different mental health conditions. Leadership and management talks about managing care and leading the team. And then it goes to clinical rotations. Rotations can be quite exciting and stressful because now you're going to the hospital. Now you're doing hands-on care on actual patients, not mannequins anymore. During your nursing rotation, learn as much as possible. Ask a lot of questions. Be hands-on. There's little techniques in there for you to pass and succeed in nursing school. If you want a video explaining how to study for nursing school, the difference between someone that succeeds and passes nursing school and someone who fails nursing school is their mindset. It's the willingness to keep on going, keep on persevering, and not quit. So please do not quit. You can keep doing this. Ask as many questions as you can to your professors and don't give up. Oh my gosh, you're literally almost at the end of nursing school. That is big. It's wild. It's a big stepping stone. The next step is step number 4, you taking that exit exam. Most nursing school have an exit exam. Some can be Kaplan, but mine was ATI. This exit exam determines how ready you are for you to pass or take the NCLEX. For the ATI, it gives you a readiness test, and there's a percentage of how ready you are for you to pass your NCLEX at the first time. Do not take it lightly. This is very important. The higher your score, the higher chance of you passing NCLEX. This test is usually done during the final semester of nursing school. It combines all your courses together and uses real NCLEX style questions that you may see on your NCLEX exam. Please take your exit exam seriously, because if you also do not pass your NCLEX exam, particularly in my nursing program, you cannot graduate from nursing school. And there are lots of study materials out there for you to use. Step number 5, graduation. You did great on your exit exam. Now it's time for you to celebrate. Well, that is very exciting. You completed all of those courses. Now it's time for you to celebrate with your family and your friends who kept cheering you on and helping you and motivating you to complete it. Joy. But that doesn't mean that you're a nurse. Not yet. You need to complete one important step. That step is taking your NCLEX exam. Step number 6, you are ready to take your NCLEX. I don't know, I keep dancing throughout because this has been a long journey. You're literally a step away from you being a licensed registered nurse. The NCLEX exam is an official exam every nursing graduate must take, and this determines if you can be a registered nurse. This NCLEX exam is adaptive, is all about critical thinking, prioritization, and safe nursing judgment. You cannot memorize or cram the day before the NCLEX. It is impossible. This exam is not similar to any of your nursing exams. This is all about critical thinking, and particularly during your final nursing semester, your professors will gradually start introducing more NCLEX style questions, so it makes it easier before you take your NCLEX exam. Quick tips before you take your exam. You need to study every single day, or it pretty much depends on your schedule, but you have to do as much practice questions as possible. You just don't move on to the next question. You have to read the rationale and understand the reason why. Give yourself about a month or 6 weeks for you to prepare for the NCLEX. You field testing banks that I recommend: New World, Kaplan. A new one that I've heard is really good, NCLEX Bootcamp, everyone says is really good. It's cheaper than New World. Once you pass that NCLEX and you need to apply through your state board of nursing, then your board of nursing will send you that license that you worked so hard for, your nursing license. Congratulations. Now you got your nursing license. You can't just stay at home and think that you're able to utilize your license. You have to apply for your first nursing job. That is step number 7. Oh my gosh, you got your nursing license. Now we're going to get our first nursing job. It can be scary deciding what specialty should I choose. Majority of my professors said start on med surg. Some people said you can start in emergency. I started as a cardiac step down nurse and I loved it. And then I transitioned to the CV ICU, and right now I am a heart transplant nurse navigator. So I've always been in that cardiac specialty. See, your first job really matters and it can actually shape your nursing journey. So pick the job wisely. Just don't pick any job that gives you the most amount of money. Look at the people that you're going to work for. Shadow the unit. Try to understand the dynamic before accepting a nursing job position. What you need to include in your resume: include your clinical rotation, your experience, any certification that you did, particularly your BLS. Keep that up to date. You can also include any references, like from your professors or your clinical instructor. Any volunteer experience. Maybe you used to work in a fire department, or you were a CNA, or you were a student nurse extern. And if you don't have any particular nursing experience other than your clinical rotation, you may have helped with kids doing volunteer work, sharing food at a food drive. Look for something that is related to nursing, or also just showcase your qualities. Another tip I will include is the need for you to find a nursing job that ties with a nurse residence program. A nurse residence program is usually 12 months, so it's about a year. This program is designed for nurses who just passed their NCLEX, so new grad nurses or nurses who had that long break from bedside. It gives you more training time, a longer orientation time. You're paired with a preceptor. You have to do a particular project, and it gives you time with meeting with other new nurses. I found a lot of good friends through my nursing residency program. So look for a nursing job that also includes a nurse residency program. So now you got this, you completed it, you're finally a nurse. Congratulations. Now that you're finished with this video, I want to know where you are in this process. Are you just getting accepted to the nursing program? Are you still considering? Are you preparing for the NCLEX? Please let me know down below in the comments. Please also subscribe to my channel, Your Nurse Preceptor, where I share more tips, study advice, an easy way for you to remember nursing topics. If you have any particular topic you'd like for me to discuss, please let me know down below. Or if you're already in nursing school, what particular subject are you having problems with? And I'm willing to explain it in simple terms so you can understand it easier. Thank you so much for watching this video and have a wonderful day. Please subscribe. See you next time. Bye.